Guru Subramaniam sir and postgraduate Guru Ranganathan sir sitting together and listening to me. That's a great pleasure and it's more exciting for me. Okay. So this is the question which Ramakant sir and madam has asked. What is the oral pathology and dental practitioner? Then I started scratching my head what to talk. This is an area which is vast, not related to the as such to oral pathology. Then whoever it is a practitioner. Is basically we teach oral pathology in undergraduate also, and we teach oral pathology in post-graduation course also. So two things are all of you will accept with me. One, any person who is doing a good practice should have a thorough theoretical knowledge and of course skills. These two are very important. Everybody accept that? This a little bit of reciprocation period. Okay, it will not be didactic. Yes. Thank you. Now, thus the balance between knowledge and skill. Is there any factor which balances this? Any guess? The factor which balances knowledge and skill, and which most of the students and young faculty are lacking. Any guess?
Passion.
Okay. That is communication skills. You have knowledge, and if you are not able to communicate properly, that knowledge will go away. You have skill, but you cannot communicate properly with your patient, that goes away. So knowledge and skill together has to have a communication skill. That is the most important balancing part. It's like homeostasis. So that is the bridge. If the bridge collapses, done. We have knowledge this side, we have skill this side. These are never integrated together. So what decides knowledge? This is the question. Marks is equal to knowledge. No? That is what we do know. The distinction candidate, please come onto the stage. He has got the highest marks. Give him a big hand. That is what we normally do that, right? Knowledge is marks. True or false? False. Then what is knowledge? A big question mark again. So basically, if knowledge is that, we in Andhra and Telangana, we take second language as Sanskrit. None of the students will give less than 98, 99. But they don't know a single word in Sanskrit. They are the toppers and this. So knowledge is not related to your marks. That is a way of assessment. So, no knowledge. This is the question which normally, lack of knowledge in undergraduates, always catching. Why this is happening? Is there any defect in our education system as such? Lack of medical language. How many of us are teaching medical language before entering into the subject? When I was in third period, still Subramaniam sir came to me, I never knew there is a medical language. I was just reading from the textbook, answer, very good, Govindraj, you are explaining everything. I am not explaining, I am just remembering what I remembered, I was just telling it out. There is nothing. So, example, I will tell you how it happens. Syncytiotrophoblasts. These are the cells which invade into the endometrium and all. But none of the students know the meanings of these words. Nobody teaches that. We just explain them and we ask them to remember. But if we know that any word which starts with sin is together. What is together? Cytos. Cells are coming together. Why they are coming together? Because of tropho. If you don't know the meaning of tropho, we start mugging it up. We can't remember many words. Tropho means nutrition. Nutrition for what? Blast, germ cells. So germ cells are coming together to have nutrition. That's why it is called syncytiotrophoblasts. This I got to know only not in the first periods. After entering into third periods, when Subra sir told me, every word has got a meaning. That is etymology. None of us teach the language and we want to expect the students to get good knowledge. Next, this is the big question. Why lectures are boring and movies are interesting? Movies we know hero, heroine and villain. Hero will definitely win the villain and finally heroine will like. No matter we know the story before, still we pay 200 and we sit nicely to listen what will happen next. Whereas we have clinical features, definition, radiology and everything, still it is boring. Why? What makes the movie so interesting when we know the story beforehand?
Songs, dance.
It's not songs. It is the narration which they say. It is the narration, how the screenplay is being done. No matter what, that is why they will listen to it. If not, we know the story, but still we go, how we will narrate. That we are not doing in our lectures. What we do? Didactic, stand still. This is what is it. Tumor is defined as abnormal mass of a tissue, the growth of which uncoordinated the surrounding tissue, and the tissue persists in the same excessive manner even after the stimulation. I did nicely. Expectation from the student that you have known so much. Nothing. You need to explain that. What are skills? The skills are, if you know, now knowledge is over, skills, mechanical skills. This is learning like a mechanic. Mechanics does a beautiful work. If you take a vehicle there, he will repair it. By listening the sound, he will tell that. Analytic mechanic. But an engineer will tell why is the reason for that. That is, reasoning is important. Now, when you are telling students, it is always tell them and show them the content with examples. You say avulai appearance, you show them what is avulai appearance looks like. That is why long-term memory will be there. And anag. We say the predisposing factor for anag is smoking. What is the relationship between smoking? If I smoke, why should I get anag? Everybody doesn't get anag. Why? Why we are calling it trench mouth? Because when you smoke continuously, when you are in stress, adrenaline is released. When adrenaline is released, it causes peripheral vasoconstriction. When peripheral vasoconstriction, decreased ischemia, anaerobic bacteria survives. That's how we get anag. Now we are developing a relation. This I understood when I joined Ragas. Before I used to tell anag clinical features are very good now. So I used to ask why? Why? That is not there in the book. You need to analyze. You need to have your basics strong. Know the normal first, then only abnormal will be appreciated. One more, 2 slides. This is also one, this question we asked for all the faculty also. Diabetic foot healing does not happen very easily. Most of them tell, to my surprise, because the bacteria survives eating that sugar. That's why we'll have. Nobody, very few faculty from different departments know the answer, that is defective chemotaxis. It's a collagen disorder, defective tumor. Very few of them know. They are teaching to the students.